Hello everyone, and welcome back to a Vital Nursing 101 video. Today we are going to talk about Tramadol. Tramadol is one of those medications that can be a little confusing for nursing students because it is sometimes described as a weaker opioid, or a different kind of pain medication. But here is the most important thing to remember right away. Tramadol is still an opioid medication. It can help with pain, but it can also cause serious side effects, including respiratory depression, sedation, falls, dependence, misuse, seizures, and serotonin syndrome, so we do not treat Tramadol like it is harmless. In this video, we are going to break Tramadol down step by step. We will talk about what Tramadol is used for, how it works, how it is different from other opioids, important side effects, black box warnings, nursing responsibilities, lab monitoring, patient teaching, and what findings should be reported to the provider. And throughout the video, I will add pop test questions to help you think like a nurse. Let's start with the basics. Tramadol is an opioid analgesic. Analgesic means pain reliever. Tramadol is used to treat pain that is moderate to moderately severe, or pain severe enough that a provider decides an opioid medication is needed. You may see Tramadol used for acute pain, chronic pain in certain situations, post-injury pain, musculoskeletal pain, or pain that is not controlled well enough with non-opioid medications. Tramadol may be ordered when acetaminophen, NSAIDs, rest, ice, heat, physical therapy, or other treatments are not enough or are not appropriate. But Tramadol is not usually the first medication we reach for when pain can be treated safely with non-opioid options. That is because Tramadol still has opioid risks. A simple memory tip is, Tramadol treats pain, but treat it like an opioid. Even if a patient says, it is just Tramadol, the nurse should still think, respiratory rate, sedation, fall risk, interactions, seizures, serotonin syndrome, and safe use. Pop test question. Tramadol is classified as what type of medication? A. Antibiotic. B. Opioid analgesic. C. Antihistamine. D. Anticoagulant. The correct answer is B. Tramadol is an opioid analgesic used to treat moderate to moderately severe pain. Now let's talk about how Tramadol works. Tramadol has a dual mechanism of action. Dual means two. First, Tramadol binds to mu-opioid receptors. Mu-opioid receptors are opioid receptors in the brain and spinal cord that help change how the body perceives pain. This is the opioid part of Tramadol. Second, Tramadol affects neurotransmitters called serotonin and norepinephrine. It helps prevent the reuptake of serotonin and norepinephrine, which means more of these neurotransmitters stay available in the nervous system. This can also help change pain signaling. So Tramadol works partly like an opioid and partly by affecting serotonin and norepinephrine. That dual action is what makes Tramadol different from some other opioids. But that same dual action also creates extra safety concerns. Because Tramadol affects serotonin, it can increase the risk of serotonin syndrome, especially when combined with other serotonergic medications. Because Tramadol affects the brain and nervous system, it can also lower the seizure threshold. Lowering the seizure threshold means it can make seizures more likely in some patients. Memory tip. Tramadol has two tracks, opioid track and serotonin, norepinephrine track. Two tracks for pain relief, but also two tracks for side effects. Pop test question. Which statement best describes how Tramadol works? A. It only kills bacteria. B. It binds to opioid receptors and also affects serotonin and norepinephrine. C. It only lowers blood sugar. D. It only blocks histamine. The correct answer is B. Tramadol has opioid effects and also affects serotonin and norepinephrine. Now let's talk about why Tramadol is used. Tramadol may be prescribed for pain that is not relieved well enough by non-opioid medications. For example, a patient has a painful injury and cannot take NSAIDs because they have a history of stomach bleeding. The provider may choose Tramadol for a short time, depending on the patient's risk factors. Another example, a patient has moderate pain after a minor procedure and needs something stronger than acetaminophen. The provider may order Tramadol as needed. Another example, a patient has chronic pain, and the provider has decided Tramadol is appropriate as part of a larger pain management plan. In all of these cases, Tramadol should be used carefully. The goal is to reduce pain enough to improve function. Function means the patient can move, sleep, cough, deep breathe, participate in therapy, or perform daily activities more comfortably. The goal is not always zero pain. For example, after a painful injury, reducing pain from 8 out of 10 to 4 out of 10 may be enough for the patient to walk safely and rest. As nurses, we reassess both pain relief and safety. Did the pain improve? Is the patient too sleepy? Is the breathing okay? Can the patient walk safely? Is the patient nauseated? Do they understand how to take it safely? Pop test question. A patient receives Tramadol for pain. What should the nurse reassess? A. Pain level, sedation, respiratory status, and safety. B. Only the patient's favorite food. C. Only the patient's height. D. Only the room temperature. The correct answer is A. After giving Tramadol, the nurse should reassess effectiveness and safety. Now let's compare Tramadol with other pain medications. Acetaminophen, also known as Tylenol, helps with pain and fever, but it is not an opioid and does not treat inflammation well. NSAIDs like ibuprofen and naproxen help with pain, fever, and inflammation, but they can increase the risk of stomach bleeding, kidney injury, and cardiovascular problems. Opioids like morphine, hydromorphone, oxycodone, and tramadol are used for more significant pain but can cause sedation, respiratory depression, constipation, dependence, misuse, and overdose. Tramadol is sometimes viewed as less strong than opioids like morphine or hydromorphone, but that does not mean it is risk-free. Tramadol still acts on opioid receptors. Tramadol can still cause respiratory depression. Tramadol can still lead to dependence and withdrawal. Tramadol can still interact dangerously with alcohol, benzodiazepines, sleep medications, and other sedatives. And Tramadol has 2 extra testable risks: seizures and serotonin syndrome. So the nursing student memory tip is, Tramadol is an opioid with extras. The extras are serotonin syndrome risk and seizure risk. Pop test question. Which risk is especially associated with Tramadol compared with many other opioids? A. Serotonin syndrome and seizures. B. Blue hair. C. Low calcium. Only. D. Increased height. The correct answer is A. Tramadol can increase the risk of serotonin syndrome and seizures, especially in high-risk patients or with interacting medications. Now let's talk about common side effects. Common Tramadol side effects include dizziness, drowsiness, nausea, vomiting, constipation, headache, dry mouth, sweating, and fatigue. Dizziness and drowsiness matter because they increase fall risk. Nausea and vomiting matter because they can affect hydration, nutrition, comfort, and medication tolerance. Constipation matters because opioids slow the gastrointestinal tract. Even though Tramadol may be considered less constipating than some stronger opioids, constipation can still happen. So patients may need fluids, fiber if appropriate, mobility as tolerated, and stool softeners or laxatives if ordered. Dry mouth and sweating can also occur. Some patients may feel lightheaded, foggy, or unsteady. This is especially important for older adults. An older adult taking Tramadol may be at higher risk for confusion, falls, and injury. Memory tip. Tramadol can make patients dizzy, drowsy, and dry. Dizzy, drowsy, dry mouth, and do not forget constipation. Pop test question. Which common side effect should the nurse teach patients about with Tramadol? A. Drowsiness and dizziness. B. Permanent improved vision. C. Faster bone growth. D. Increased hearing. The correct answer is A. Tramadol can cause drowsiness and dizziness, which increases fall risk. Now let's talk about the most serious opioid-related side effect: respiratory depression. Respiratory depression means breathing becomes too slow, too shallow, or ineffective. Tramadol can cause serious or life-threatening breathing problems, especially when therapy is started, after a dose increase, or when combined with other central nervous system depressants. Central nervous system depressants include benzodiazepines, alcohol, sleep medications, muscle relaxants, sedating antihistamines, some antipsychotics, and other opioids. Examples of benzodiazepines include lorazepam, alprazolam, diazepam, and clonazepam. A dangerous combination would be tramadol plus alprazolam plus alcohol. That combination can increase sedation, slow breathing, and increase overdose risk. Patients with COPD, sleep apnea, asthma, older age, or general frailty are at higher risk. Children also have special risks, and tramadol is contraindicated in certain pediatric situations, including after tonsillectomy or adenoidectomy. For nursing students, the key safety point is always assess respiratory rate and sedation. Do not just ask, "Are you in pain?" Also ask and assess, "Are they awake? Are they easy to arouse? Are they breathing normally?" Pop test question: which finding is most concerning after tramadol administration? A. Patient is difficult to arouse and breathing 7 times per minute. B. Patient says pain improved. C. Patient asks for a blanket. D. Patient drinks water. The correct answer is A. Difficulty arousing the patient with a respiratory rate of 7 may indicate opioid-induced respiratory depression. Now let's talk about seizures. Tramadol can increase seizure risk. This can happen even at recommended doses, but the risk increases with higher doses, overdose, or use with medications that lower the seizure threshold. A seizure threshold is like the brain's resistance to having a seizure. If a medication lowers the seizure threshold, it makes seizures easier to trigger. Patients at higher risk include those with a history of seizures, epilepsy, head trauma, brain tumors, alcohol or drug withdrawal, metabolic problems, or those taking other medications that lower seizure threshold. Some antidepressants, antipsychotics, other opioids, stimulants, and certain other medications may increase seizure risk when combined with tramadol. This is why medication reconciliation is so important. Medication reconciliation means reviewing all prescribed medications, over-the-counter medications, supplements, and substances the patient uses. If a patient has a seizure after taking tramadol, that is a serious finding and should be reported immediately. Pop test question: a patient with a seizure disorder is prescribed tramadol. What should the nurse do? A. Recognize seizure risk and clarify safety concerns with the provider. B. Ignore the history. C. Double the dose. D. Give it with alcohol. The correct answer is A. Tramadol can increase seizure risk, so seizure history is an important safety concern. Now let's talk about serotonin syndrome. Because tramadol affects serotonin, it can contribute to serotonin syndrome. Serotonin syndrome is a potentially life-threatening condition caused by too much serotonin activity in the nervous system. This risk increases when tramadol is combined with other medications that increase serotonin. Examples include SSRIs like sertraline, fluoxetine, citalopram, and escitalopram. SNRIs like venlafaxine and duloxetine. MAOIs. Tricyclic antidepressants. Triptans used for migraines. Linezolid. Lithium. St. John's wort. And some other medications. Symptoms of serotonin syndrome can include agitation, confusion, anxiety, restlessness, sweating, fever, fast heart rate, high blood pressure, diarrhea, nausea, vomiting, tremor, muscle rigidity, muscle twitching, and hyperreflexia. Hyperreflexia means overactive reflexes. In severe cases, serotonin syndrome can lead to seizures, high fever, irregular heartbeat, unconsciousness, or death. Memory tip: too much serotonin makes the body hot, fast, tight, and confused. Hot from fever and sweating, fast from fast heart rate and high blood pressure, tight from muscle rigidity and tremor, confused from mental status changes. Pop test question: a patient taking tramadol and sertraline develops fever, agitation, sweating, diarrhea, tremors, and muscle rigidity. What should the nurse suspect? A. Serotonin syndrome. B. Normal expected pain relief. C. Low calcium only. D. Seasonal allergies. The correct answer is A. Tramadol can increase serotonin syndrome risk, especially when combined with serotonergic medications like SSRIs. Now let's talk about dependence, misuse, and withdrawal. Tramadol is a controlled substance because it has potential for misuse, addiction, dependence, and overdose. Dependence means the body adapts to the medication, and withdrawal symptoms can occur if it is stopped suddenly. Addiction is a behavioral pattern involving compulsive use despite harm. Misuse means taking the medication in a way that is not prescribed. Examples include taking extra doses, taking someone else's medication, crushing extended-release tablets, or mixing it with alcohol to increase the effect. Withdrawal symptoms from Tramadol can include anxiety, restlessness, sweating, chills, nausea, vomiting, diarrhea, muscle aches, trouble sleeping, runny nose, yawning, and increased pain. Because Tramadol also affects serotonin and norepinephrine, some people may also have unusual withdrawal symptoms like panic, tingling, mood changes, or sensory disturbances. Patients should not stop Tramadol suddenly unless directed by a provider. The provider may taper the dose gradually to reduce withdrawal symptoms. Pop test question: why should Tramadol not be stopped suddenly after regular use? A. It may cause withdrawal symptoms. B. It causes instant infection. C. It becomes an antibiotic. D. It permanently cures pain. The correct answer is A. Stopping Tramadol suddenly after regular use can cause withdrawal symptoms. Now let's talk about black box warnings and major warnings. Tramadol carries opioid boxed warnings. These include addiction, abuse, and misuse, which can lead to overdose and death. It also includes life-threatening respiratory depression. It includes accidental ingestion, especially by children, which can be fatal. It includes neonatal opioid withdrawal syndrome, if opioids are used for a prolonged period during pregnancy. It includes dangerous interactions with benzodiazepines or other central nervous system depressants. Some Tramadol products also warn about ultra-rapid metabolism in children. This has to do with CYP2D6, a liver enzyme that helps convert Tramadol into its more active metabolite. Some people are ultra-rapid metabolizers, which means they convert Tramadol faster and may have higher active opioid effects. This can increase the risk of dangerous respiratory depression. That is why Tramadol has special warnings and contraindications in children. For nursing school, remember, Tramadol is not just mild pain medicine. It is an opioid with boxed warnings. It can cause fatal respiratory depression. It can be misused. It can interact with sedatives. It can cause seizures. It can cause serotonin syndrome. Memory tip: Tramadol trouble, breathing, brain, and serotonin. Breathing, respiratory depression. Brain, seizures and sedation. Serotonin, serotonin syndrome. Now let's talk about nursing responsibilities before giving Tramadol. First, assess the patient's pain. Ask the pain level, location, quality, duration, and what makes it better or worse. Also assess whether Tramadol is appropriate for the level and type of pain. Second, assess respiratory status. Check respiratory rate, depth, oxygen saturation, and lung history. Ask about COPD, asthma, sleep apnea, or other breathing problems. Third, assess sedation level. Is the patient alert, drowsy, confused, difficult to arouse? Do not give opioid medications automatically to a patient who is overly sedated. Fourth, assess blood pressure and fall risk. Tramadol can cause dizziness and lightheadedness. Fifth, assess seizure history. Ask about epilepsy, previous seizures, head injury, brain tumors, alcohol withdrawal, or medications that lower seizure threshold. Sixth, assess medication interactions. Look for antidepressants, especially SSRIs, SNRIs, MAOIs, tricyclics, and other serotonergic medications. Look for benzodiazepines, sleep medications, muscle relaxants, alcohol, and other CNS depressants. Look for other opioids. Seventh, assess kidney and liver function. Tramadol is processed by the liver and eliminated partly through the kidneys. Dose adjustments may be needed in renal or hepatic impairment. Eighth, assess pregnancy and breastfeeding status when relevant. Opioid exposure can affect newborns, and Tramadol is not recommended during breastfeeding because of risk to the infant. Ninth, check allergies and previous reactions. Ask about reactions to Tramadol or other opioids. Pop test question: before giving Tramadol, which history is especially important to assess? A. Seizure history and serotonergic medication use. B. Favorite color. C. Shoe size. D. Hair type. The correct answer is A. Tramadol can increase seizure risk and serotonin syndrome risk, so these assessments are important. Now let's talk about lab monitoring. There is no routine tramadol blood level that nurses commonly monitor, but labs and clinical monitoring still matter. For kidney function, monitor BUN, creatinine, and eGFR when relevant. If kidney function is decreased, tramadol or its metabolites may accumulate, increasing the risk of side effects. For liver function, monitor AST, ALT, bilirubin, and other liver tests if the patient has liver disease or provider concern. Because tramadol is metabolized by the liver, impaired liver function can affect medication clearance. For respiratory safety, labs may not be the first indicator. The nurse's assessment is key. Respiratory rate, sedation level, oxygen saturation, and sometimes capnography are important in higher-risk patients. If overdose is suspected, providers may order toxicology testing, arterial blood gas or venous blood gas, acetaminophen level if combination products are involved, electrolytes, glucose, and other emergency labs. Why glucose? Because altered mental status can also be caused by hypoglycemia. Why acetaminophen level? Because some patients may take multiple pain medications, and acetaminophen toxicity can be hidden. If the patient has a seizure, labs may include electrolytes, glucose, renal function, and other tests depending on the clinical situation. Pop test question. Which monitoring is most important after giving tramadol? A. Respiratory rate, sedation level, pain relief, and safety. B. Hair length. C. Eye color. D. Favorite music. The correct answer is A. Tramadol is an opioid, so respiratory and sedation monitoring are essential. Now let's discuss administration tips. Tramadol is usually given by mouth. It may come as immediate-release tablets, extended-release tablets, capsules, or other formulations depending on the product. Immediate-release tramadol is typically used for pain that needs shorter-term or as-needed management. Extended-release tramadol is used for around-the-clock pain control in selected patients and should not be used as an as-needed medication. Extended-release tablets or capsules should not be crushed, chewed, split, or dissolved unless the product instructions specifically allow it. Crushing extended-release tramadol can release too much medication at once. That can cause overdose and respiratory depression. Tramadol may be taken with or without food, but patients should be consistent with how they take certain formulations if instructed. Teach patients to take only as prescribed. Do not take extra doses. Do not take it more often than ordered. Do not combine it with alcohol or sedatives. Do not share it with anyone. Store it securely. Pop test question. Why should extended-release tramadol not be crushed? A. It can release too much medication at once and cause overdose. B. It makes the medication become harmless. C. It prevents constipation. D. It makes pain worse immediately. The correct answer is A. Crushing extended-release opioids can cause rapid release and overdose. Now let's talk about patient teaching. Teach patients that tramadol is an opioid pain medication. Even if it is considered less potent than some opioids, it can still be dangerous if misused. Teach patients to take it exactly as prescribed. Do not take more. Do not take it more often. Do not mix it with alcohol. Do not mix it with benzodiazepines, sleep medications, muscle relaxants, or other sedatives unless the provider specifically says it is safe. Teach patients not to drive, operate machinery, climb ladders, or perform risky activities until they know how tramadol affects them. It can cause drowsiness, dizziness, and slowed reaction time. Teach patients to change positions slowly. This helps reduce dizziness and falls. Teach about constipation. Encourage fluids, fiber if appropriate, movement as tolerated, and stool softeners or laxatives if ordered. Teach patients to report no bowel movement, severe constipation, abdominal swelling, vomiting, or inability to pass gas. Teach patients about serotonin syndrome. They should seek help for agitation, confusion, fever, sweating, fast heartbeat, diarrhea, tremor, muscle stiffness, or hallucinations. Teach patients about seizure risk. They should report any seizure activity or unusual neurological symptoms. Teach patients not to stop tramadol suddenly if they have been taking it regularly. They should talk to the provider about tapering. Teach safe storage. Keep tramadol away from children, pets, visitors, and anyone for whom it was not prescribed. Accidental ingestion can be fatal. Teach safe disposal. Unused tramadol should be disposed of through a drug take-back program or according to pharmacy guidance. Teach patients that naloxone may be recommended. Naloxone is the opioid reversal medication used for suspected opioid overdose. Teach patients and families to recognize overdose symptoms: slow breathing, extreme sleepiness, inability to wake up, blue lips, or limp body. Pop test question. Which patient statement shows correct teaching? A. I should avoid alcohol while taking tramadol. B. I can take extra tramadol if my pain is still bad. C. I can share tramadol with my friend. D. It is safe to crush extended-release tramadol. The correct answer is A. Alcohol can increase sedation, respiratory depression, overdose risk, and death when combined with tramadol. Now let's talk about what findings should be reported to the provider. Report respiratory depression. This includes slow breathing, shallow breathing, pauses in breathing, low oxygen saturation, or difficulty breathing. Report excessive sedation. If the patient is difficult to arouse, confused, unusually sleepy, or unable to stay awake, report it. Report signs of serotonin syndrome. These include agitation, confusion, fever, sweating, fast heart rate, high blood pressure, diarrhea, tremor, muscle rigidity, twitching, hyperreflexia, or hallucinations. Report seizure activity. Any seizure in a patient taking tramadol is important. Report severe dizziness, falls, fainting, or unsafe mobility. Report allergic reactions. These include hives, swelling of the face or throat, wheezing, or trouble breathing. Report severe nausea, vomiting, or constipation. Report urinary retention if the patient cannot urinate. Report signs of misuse, taking more than prescribed, or combining with alcohol or sedatives. Report worsening kidney or liver function. Report pregnancy or breastfeeding concerns if they come up. Report uncontrolled pain. If pain is not improving, the provider may need to reassess the cause of pain or adjust the plan. Pop test question. A patient taking tramadol develops fever, agitation, tremor, diarrhea, and muscle rigidity. What should the nurse do? A. Report possible serotonin syndrome. B. Give another dose immediately. C. Tell the patient this is expected. D. Ignore it if pain improved. The correct answer is A. These findings may indicate serotonin syndrome and should be reported immediately. Now let's walk through a clinical scenario. You are caring for Ms. Carter, a 62-year-old patient with knee pain. She has an order for tramadol as needed. Before giving the medication, you assess her pain. She rates it 7 out of 10. You assess her respiratory rate. It is 16 breaths per minute. She is awake and alert. Her blood pressure is stable. Then you review her medication list. You see that she takes sertraline for depression and trazodone for sleep. What should you think? You should think about interaction risk. Sertraline and trazodone can affect serotonin. Tramadol can also affect serotonin. This does not automatically mean the patient can never receive tramadol, but it does mean the nurse should be alert for serotonin syndrome and may need to clarify with the provider or pharmacist, depending on the patient's risk and facility policy. You should also assess sedation risk because trazodone can cause drowsiness. After giving tramadol, you reassess pain, sedation, respiratory status, dizziness, and any unusual symptoms. Let's do another scenario. You are caring for Mr. Davis, who received tramadol for pain after a fall. 1 hour later, he is very drowsy, hard to arouse, and breathing 8 times per minute. What should you do? This is concerning for opioid-induced respiratory depression. You should stimulate the patient, assess airway and breathing, check oxygen saturation, call for help, notify the provider or rapid response according to facility policy, and prepare for naloxone if ordered or per protocol. Do not document patient sleeping and walk away. A sedated patient with slow respirations after tramadol is a safety emergency. Here is another scenario. A patient says, I take tramadol from my husband's prescription when my back hurts. What should you teach? You should teach that tramadol should only be taken by the person it was prescribed for. Sharing opioids is dangerous and illegal. The dose that is safe for one person may be unsafe for another. Tramadol can interact with other medications, cause breathing problems, seizures, serotonin syndrome, dependence, and overdose. The patient should contact a healthcare provider for their own pain evaluation and treatment plan. Now let's review the nursing school must-know points. Tramadol is an opioid analgesic. It is used for moderate to moderately severe pain, or pain severe enough to require an opioid. It works by binding to mu-opioid receptors and affecting serotonin and norepinephrine reuptake. It can cause dizziness, drowsiness, nausea, vomiting, constipation, dry mouth, sweating, and fatigue. It can cause serious respiratory depression. It can increase seizure risk. It can cause serotonin syndrome, especially with serotonergic medications. It can cause dependence, misuse, addiction, withdrawal, overdose, and death. It should not be combined with alcohol, benzodiazepines, sleep medications, or other CNS depressants unless specifically directed by the provider. Extended-release tramadol should not be crushed, chewed, split, or dissolved. Important nursing assessments include pain level, sedation, respiratory status, blood pressure, fall risk, seizure history, medication interactions, kidney function, liver function, pregnancy or breastfeeding status when relevant, and patient understanding. Important monitoring includes pain relief, respiratory rate, sedation level, oxygenation, dizziness, falls, bowel function, signs of serotonin syndrome, seizure activity, and signs of misuse. Patient teaching should focus on taking it exactly as prescribed, avoiding alcohol and sedatives, not driving until effects are known, preventing constipation, storing securely, disposing safely, not sharing medication, recognizing overdose, and reporting serious symptoms. Memory tip: Tramadol is an opioid with extras, seizures, and serotonin. Now let's finish with 5 true or false review questions. Question 1. True or false? Tramadol is an opioid analgesic. The correct answer is true. Rationale: Tramadol acts on opioid receptors and is used to treat moderate to moderately severe pain, or pain severe enough to require an opioid. Question 2. True or false? Tramadol has no risk of respiratory depression because it is weaker than morphine. The correct answer is false. Rationale: Tramadol can still cause serious or life-threatening respiratory depression, especially when starting therapy, increasing the dose, or combining it with alcohol, benzodiazepines, opioids, or other CNS depressants. Question 3. True or false? Tramadol can increase the risk of seizures. The correct answer is true. Rationale: Tramadol can lower the seizure threshold, and the risk increases with higher doses, overdose, seizure history, and certain interacting medications. Question 4. True or false? Serotonin syndrome is a possible risk when tramadol is combined with medications such as SSRIs or SNRIs. The correct answer is true. Rationale: Tramadol affects serotonin and norepinephrine. Combining it with other serotonergic medications can increase the risk of serotonin syndrome. Question 5. True or false? It is safe to crush extended-release tramadol if the patient has trouble swallowing. The correct answer is false. Rationale: Extended-release tramadol should not be crushed, chewed, split, or dissolved because too much medication can be released at once, increasing the risk of overdose and respiratory depression. And that is your beginner-friendly nursing pharmacology review of tramadol. Remember, tramadol is not just a mild pain pill. It is an opioid medication with important extra risks. Always think about breathing, sedation, falls, constipation, dependence, seizures, serotonin syndrome, and medication interactions. As a nurse, your job is to assess before giving it, monitor after giving it, teach patients clearly, and report concerning findings early. Thank you for watching, and I'll see you in the next nursing pharmacology lesson.